The session here is Current Challenging and Emerging Approaches, CAD Diagnosis in a New Era of Patient Management. So we're going to be talking a lot about coming to a diagnosis, some of the diagnostic tests, and with a particular emphasis on a new diagnostic test. In terms of the agenda, so my name is Alexandra Lansky. I'm from Yale University. I'm the head of clinical research for the cardiovascular division there, and I'm very pleased to introduce Joe Lapado, who is assistant professor from the Department of Population Health at NYU. And you can see here from the agenda, he's going to be laying the foundation, talking about the challenges in the clinical evaluation of patients with suspected coronary disease. Greg Thomas, to our left, is a professor at UC Irvine and is the director of nuclear cardiology education there. He's going to be talking and focusing on this novel testing and paradigm for suspected obstructive coronary disease. So really we're going to start understanding what this test is all about, and he's going to be discussing some of the clinical data behind that. I'm going to be talking about a very special population that is making the diagnosis in female patients. Very challenging patient population. We'll go into some of those details. So just by way of introduction, I just have a few slides to kind of set the tone here, but putting this in context and just talking about the scope of the problem, particularly in the United States, this is a huge, huge problem. You can see here in terms of evaluation of acute chest pain syndromes, this represents over 6 million evaluations in this country on an annual basis, so enormous. And you can see here the economic burden. We're talking about over $3 billion on an annual basis. Now, if you take that one step further and you look at the evaluation of patients with stable chest pain syndromes, you're looking at 50 million evaluations on an annual basis. Again, enormous. In terms of the annual cost, it's about $14 billion. So clearly, this is a huge challenge, and we've got a long ways to go in terms of addressing and narrowing the gap in terms of the diagnostic evaluation of these patients. Now, as a cardiologist, there's a whole host of different non-invasive tests that we have to choose from, and the question is, what is the value of each one of these tests? Which is the best test to use in a specific patient? So we're going to be reviewing some of that information, and again, we're going to be talking about this novel test. I think it's very exciting, and I think it's particularly applicable to primary care, internal medicine, and what are the gaps? What are the gaps in terms of test performance? Clearly, most of the validation studies of non-invasive tests that have been done in very controlled settings. They have been done in registries or retrospective analyses, and there's very few prospective randomized evaluation looking at these diagnostic tests. And importantly, I don't think there's a whole lot of data done in real-world setting, in the clinic, in physician practice settings, and I think that has important implications on the results that we see from these tests. The other issue is the test performance. Clearly, as you'll hear, is very dependent on the population and the risk of the population. So we'll really discuss that in detail. And of course, different tests may apply or have benefit in certain subgroups. And I'm going to be focusing, of course, on the female patient population. Again, there's a whole host of emerging non-invasive diagnostic tests. And again, I think we need to understand the value of these various tests, and in particular this test that I think is absolutely exciting and potentially a game changer in terms of how we approach our patients in the evaluation and coming to a diagnosis of obstructive coronary disease. Limited information in terms of outcomes, that's absolutely true. When we look at many of the validation studies, what we're looking at is the prediction of obstructive coronary disease, but we're not necessarily looking at the prediction of outcome. And that's an important issue, and I think we're going to be seeing more and more information coming out looking at the predictability of certain tests and looking at various outcomes of patients. So just to sort of wrap this up, I think these are two very important examples. So clearly the test accuracy does decline as we're looking at lower risk populations. As you know, the pre-test likelihood of disease drives the value and the accuracy of these non-invasive tests. So if you take a look at this one single center experience here with over 100,000 non-invasive tests, what you can see is that at 1 year, about 12% of this population actually goes on to diagnostic cath. Only 4% of this population goes on to having an angioplasty. And if you look at the hard endpoints, death, myocardial infarction, and stroke only occurs in 0.7% of that population. So the question is that appropriate? Is that cost effective? And I think, again, much of the evaluation and some of the studies that are ongoing currently are trying to address this. And then another landmark study that was published back in 2010, looked at patients going to the cath lab. This was from the ACC NCDR database, were referred to the cardiac catheterization laboratory, and the vast majority of these patients, it was 62% of these patients, actually had non-obstructive coronary disease. So it's not to say that the diagnostic angiogram is the wrong thing to do. It's that we're not very accurate in selecting the patients or the appropriate patients for going to the cath lab. So I think that gives you a little bit of the foundation, some of the issues that we're sort of grappling with in terms of trying to find more accurate tests for our patients for making that diagnosis. And, you know, over the course of the next hour and a half, I think we'll sort of try and elucidate that, try and really dissect this out.